Hi, everybody. Good evening. Welcome to the webinar. Tonight's webinar is on personality disorders, specifically what we refer to as cluster B personality disorders. I think for most of us in the treatment industry and for many that have loved ones that fall into these categories, it can be one of the most challenging things to deal with. And so I want to talk about tonight about what they are. I want to talk about the induction, the way that they pull us into a dynamic that is self-sabotaging and self-defeating. And then I want to talk about ways that we can respond to them that can be both helpful for them and also make us feel okay in a relationship that can have so many challenges. So let's talk a little bit about personality characteristics, personality disorder characteristics in general. First and foremost, they're age dependent, which means that as teenagers, defined by the American Psychological Association, they cannot be fully diagnosable until the age of 18. What they want to see is they want to see these patterns and characteristics and traits that can begin to emerge in adolescence. They want them to see them become more solidified, to have a confidence in them. So it's that idea that while we might have those traits, we really don't diagnose them. And so for those of you who have adolescents, you'll hear therapists perhaps even lazily talk about narcissistic personality disorder, but what they really ought to be referring to are traits, for example. And I think what personality disorders are for those that are diagnosed and those whose loved ones are diagnosed is it's an invitation to vigilance. Like a lot of other things, it's a way to say there's a pattern here. There's a pattern, a way that one is organized, a way that one's symptoms present themselves, that we need to be aware of, because those are going to be common pitfalls for us, for both those of us in a relationship and also for the individual who's suffering through those symptoms and those patterns, those conglomerations of symptoms. There's a lot of stigma associated with personality disorders. Sometimes we even use those as insults, right? There aren't many mental health disorders that we use as commonly in a colloquial sense as an insult. Right? I hear it all the time, especially the word narcissist. And sometimes it's because of the induction, because of the way that those personality disorders make others feel when they're around them. But it's important, of course, if we're going to be helpful therapeutically, that we don't fall into that trap and that we become more careful and aware of our language around this. Tonight I'm going to talk about, like I said, the projective identification and induction. Each of these disorders have consistent patterns in relationships, right? They get people to react with a certain emotion, and that emotion can be diagnostic, whether it be helpless or crazy or feeling small or feeling scared. We'll talk about those various ways in which we feel and how to get ourselves out of that, how to get ourselves rise above that pull, right? That dynamic. I think for a lot of us, these are themes for life. You know, when you're in graduate school and you start reading around about mental health issues and specifically personality disorders, you start to see yourself in a lot of them, right? And so all these are in the deepest sense, they're all wounds. And then there's a array of symptoms that help defend that wound, that help protect the person from perceived threats. And then if they're organized in a certain way, in a certain pattern, then we give them this label as a sort of shorthand. And like a lot of things, it's a very important, that's why I talk all the time about this idea about, admitting your own personal idiocy, right? The more, we all have tendencies that get us into trouble. And calling myself an alcoholic or a codependent or somebody who suffers from narcissistic personality traits or disorders isn't a life sentence, isn't doom, isn't lowering myself. It's saying, I need to be aware of this. I do have, this is me speaking really, I do have narcissistic injuries. I do have addictive traits. I do have codependent traits. And the more I'm aware of those, the more that I'm able to stay on guard, to be aware of the pitfalls, like I said, and the ways that we get into trouble. Let's start off first with borderline personality disorder. There's a couple of things. First of all, there's a vertical and a horizontal when we're talking about diagnoses, right? The vertical axis is level of functioning, at the top being psychotic, right? Not living in the same reality as anybody else. And next, below that, is borderline level of functioning. And borderline stands between psychotic and neurotic. Neurotic is a lower grade than, of course, than psychotic. And borderline is somewhere in between. So we can all get to a borderline functioning. If you can imagine, for example, being tortured, you would eventually start to adopt some of these traits. You wouldn't necessarily have the disorder, but you would have some of these traits. I see in our society today some of these traits: the black and white thinking, the all or nothing, the shift from vilifying to kind of worshiping somebody or something or some ideology. So I'll just put that in there. But this is borderline personality disorder under the cluster B. First of all, it is marked by a disruption in attachment. Now, that disruption in attachment can take a more classic form like adoption, but it also can take more subtle forms where sometimes there's a temperamental mismatch between parent and child, right? An inability for the child to feel a sense of resonance from their parents. So it doesn't need to be a severe, but it's hypothesized that there is that part of it. Now, with all of these, there's going to be a physiological predisposition towards a certain way of demonstrating one's health and pathology, right? That's going to be there too. But these are the things that we really can and have more control over, of course. It comes from an instability of mood, right? They're going to be happy and on top of the world, often in extremes, one moment, and then the slightest of variables enters in, and they can be completely deflated, and absolutely desperate. So there's an instability of mood. The black and white thinking. I listen to this in our culture. I think about in our culture how we become borderline in so many ways, at least in our level of functioning. But this is something in this relationship that gets in the way of everyday relationships, of everyday tasks, right? It's either all or nothing. It's either an absolute overwhelming success or a catastrophic failure, right? They take things to the extreme. That's how they make sense of the world. There is no gray. There is no middle ground. You're either for me or you're against me. And that's how I make sense of the world in this fragmented way. They have this pattern of splitting, both splitting the way that I just described, but also splitting people in relationships, right? They tend to become wedges, right? They tend to create divides between parents and systems and groups of people. So there's, again, this polarization psychologically and also relationship. Very attention-seeking, right? A lot of their behaviors become reinforced by attention, right? Of course, if you're harming yourself, if you're acting out in dramatic ways, you're going to get a lot of attention. And so that's something that happens in them. And it can be very exhausting, right? They have a high requirement for that kind of attention. Chaotic and unstable relationships, self-image, identity, and behavior. You see there at the bottom of this particular slide that we're looking at, that in the ICD-10, the international coding, they call it emotionally unstable personality disorder. So this is somebody that's all over the place, that's unpredictable in all of these areas: self-image, identity, behavior, relationships, right? Lots of breakups, lots of drama in their relationships, right? Creating all kinds of problems in so many different spheres of their life. A common dynamic in their relationship is that one in their life, somebody in their life, can go from being on a pedestal to becoming vilified or demonized. And so when you know somebody who has these traits or this personality disorder, and you find yourself being the hero, be careful, because it won't be long before you're the villain. That will flip and flop more than once. There's a significant amount of dissociation with the borderline, not feeling in their body, not being present in their body. Some of this can be associated with the trauma that they experienced. Self-harming is common, and that can extend to suicidality. And it's hard because borderline, those who suffer with borderline personality disorders do kill themselves sometimes. And they have a lot of attempts very commonly. And you, as a parent, as a therapist, don't know which it's going to be. So we take them as serious as we can, as often as we need to, right? You can't just count on the fact that they're not going to, in fact, kill themselves. They may follow through, or they may accidentally, through some dangerous behavior, do that. It becomes very challenging. It's one of the most challenging diagnoses because you're set up to lose. That's the most important thing. And I'll talk about that in terms of how to respond here toward the end. You are set up to lose. And when you know that, when you know that that's the induction, that that's the pull, then you can practice letting go of it. You can stop trying to win. Like when I see therapists and treatment professionals trying to convince them of something, trying to get them to feel a certain way, to see the light, to make sense out of it, even processing ad nauseum to try to get them to that calm or stable way. The point of the disorder is you're meant to lose. You're meant to feel the kind of powerlessness and hopelessness they feel. I talk about this a lot, but projective identification, the induction process, a lot of what we feel in all of your relationships with your children, with others, ask yourself when you're having a powerful feeling, especially when that feeling comes out of nowhere, right? One moment you're feeling one way and the next moment you're having this dramatic feeling. Ask yourself, is it possible that this is exactly what this other person is feeling? And is it possible that unconsciously they want me to feel and identify the same feeling? So when you're around these folks and you start feeling hopelessness, you start feeling afraid, you start feeling exhausted, you can start to have empathy, right? Listen to the feeling that you're having to help you understand what's going on for them. For those that are vulnerable to feeling a lot of guilt and responsibility for other people, these can be particularly challenging. If you hold yourself to a standard of getting it right, of winning, so to speak, you're going to find this one a particular struggle. And you know, it's funny, when you watch treatment professionals getting run all over the place by borderlines, you can see it, right? You can see the game that's being played, that they're meant to kind of chase around. Instead of just learning to surrender, learning to let go, learning to hold on loosely. Passive-aggressive behaviors, a disconnect between the intense feelings that they have and the way that they express themselves. Often assertiveness training can be helpful. In the process, there's the best therapeutic approach that we know of today, these days, is dialectical behavioral therapy, and the skills that come along with learning how to manage emotional swings, learning how to practice abstaining from or interrupting self-harm, learning mindfulness in the process. Dialectical behavioral therapy, if you have somebody in your life that has borderline traits or borderline personality disorder, it's imperative that you find somebody who has experience, is informed by, and maybe even has a dialectical behavioral therapy clinic or practice. Of course, I said that there's a significant stigma associated with this one. We use it, like the narcissistic, almost as an insult, colloquially. They have to learn to manage self-harm, right? They have to learn to manage emotional distress, right? There's a component in dialectical behavioral therapy about learning to manage emotional distress, to tolerate that. And dialectics, the dialectic in dialectical behavioral therapy is learning to embrace seemingly opposites, like that it's possible to be both. It's possible to be doing, for example, like I talk about in the book, it's possible to be doing the best you can and also know that you can do better. Both of those things can be true. The most important thing, and I think this applies to a lot of our children, a lot of our relationships, is that with a borderline, you don't get to win. What you do is you get to choose how to lose. So I'll say that again. You don't get to win. You get to choose how to lose. And when you realize that, when you give up on winning, on getting it right, you're liberated. And then you can just more easily be with them instead of fighting against them, because it's set up for you to fight. They'll disagree with something that you empathize with right after they just said it. They'll change what they just said. So you get to choose how to lose. Let's go on to the next one in the cluster B, narcissism. This is something, maybe because of all the cluster Bs, it's the one that I identify with the most. This is one of the ones that I think is most misunderstood. I think the induction in this one asks or pulls people into the exact opposite of what the narcissists need. And most of us have a reaction to narcissism, right? We use this word to insult people. We use it in public and in social circles. We use it in family circles. I hear people diagnosing ex-spouses with this all the time, and parents with this all the time, and famous people with this all the time. Narcissism is a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy. There's a preoccupation with personal adequacy, power, and prestige, right? They will talk about their prestige and power. They will try to convince, to make a case for, to put it on display as often as possible, at the expense and the dismissal of others around them, right? The narcissist can't listen well. If you want to know how to not be narcissistic or to practice getting away from this pattern, listen to people. If you listen to people, understand them, and empathize, then you're struggling to become an effective narcissist. Most people think of it as self-centeredness. There's a self-centeredness to it. And that's a young self-centeredness. See, every 5-year-old is a narcissist, essentially. Right? Every child is a narcissist. Right? The world revolves around them. The difference with those who develop this disorder is they don't grow out of that, or they regress to that, or they stay fixated in that early stage of life. Many of you talk about your children in this way, and many of the adolescents and young adults that we treat have so many of these features because they have such an immaturity about them. There's something that's interesting, is there's such thing as a depressed narcissist too. You know, we're most commonly identifying inflated narcissists, right? The ones who talk about themselves, who brag, who can't see anybody else, who are always putting their grandiosity, their self-importance on display for everybody. The depressed narcissist is still the center of attention, and everything is about them, but it's in the negative sense. If you're over there in the corner laughing, and you're a depressed narcissist, then you assume that they're laughing about you. If your child is upset with you, then you assume it's about you. If some new policy at work happens, then it's about you, right? So the interpretation is negative and self-punishing, but it's still you being the center of everything. There's a woundedness there. The grandiose narcissist solves that wound by trying to project this larger-than-life image. The depressed narcissist is incapable of doing that, and so everything is evidence that they are bad. And I think that's an uncommon one, and one that we don't recognize often. I see that in myself as often, right? I can make it about me. It must be about me, right? That I can fall into that. Oftentimes, the classic narcissist has a lot of charisma and a lot of success, right? They're able to lead people and get people to do what they want, right? They can be very charming, and they can look very, very, they can even look like they're great people. And then, of course, when it doesn't go their way, when it doesn't meet their needs, then they really struggle. Regarding the induction and countertransference, I have a few quotes here from a blog that I wrote on drbradreedy.com called "What Really is Narcissism? The Myth of the Overvalued Child." Narcissism is not a result of being overvalued. Instead, narcissism is the result of valuing the wrong thing in the child. And what Alice Miller said about that is, she said, without therapy, it is impossible for the grandiose person to cut the tragic link between admiration and love. So the narcissist believes that their worth is in their accomplishments, and how good looking they are, how smart they are, how fast they can run, how well they can draw, the grades that they get, how well they can sing, what their body looks like, right? That's what the narcissist values or equates with their value, is what they do, how beautiful or wonderful they are. And so what therapy helps you under, that's why I have that section. I talk about being an idiot, being comfortable with your own idiocy. Right? That's the antidote to that. Is I'm okay, even though I'm a flop sometimes, even though I make mistakes, even though I'm sometimes an idiot. That's what it looks like trying to practice not equating your worth, your value with your accomplishments. And as parents, when we don't value the intrinsic worth of the child, but rather spend a lot of time praising, trying to boost their self-esteem around their accomplishments, right? Thinking that we're trying to encourage them, they equate being praised with being loved. The young child can't understand the difference when the father says, "Oh my gosh, you're so wonderful at baseball. You did so great at your grades. You're so amazing. You're so gifted." The child interprets that showering of praise as love. And then they think they need to do that to earn it. That's what the story of Midas is about. Is the equating of the value is in the goal. The value is in the kind of the external worth. Instead of just in the connection, just intrinsically valued in that. The wound is the narcissistic injury, a lack of connection and attachment in childhood. Again, this goes back to an attachment. Therapy is about the development of self, like who you are. Who you are matters, what you feel matters. Not being right, not being good, but what you feel matters. And when one experiences that, then one's self is allowed to develop. But when one has to be right or good to be valued, then one loses their sense of self-worth and has to maintain this production, if you will, to feel like they fit in and they matter in the world. The induction and the countertransference is that it's that old saying, the people that need love the most are sometimes the ones that are the hardest to give to it. And so when we just bump up against, fight against, throw names at the narcissist, that doesn't help. I don't know if you've noticed that or not with those types of individuals. And so part of what it requires in therapy is to validate them, to see them, to understand them. And most natural inclinations are, I want to knock them down to size. I want to call them on their crap. I want to let them know where they really stand. That's what we are inclined to do with this, but that perpetuates the cycle. They continue to not be seen as a scared, insecure child. Now, you don't walk up to a narcissist and say, "Well, gosh, I see you're a scared, insecure child." But when they talk about how great they are, I say, "That's true. You're really good at all that stuff. It's amazing." Right? So learning how not to perpetuate the pattern where they have to defend themselves against a perceived attack or misunderstanding. They tend to have a sensitive temperament. They suffer from being objectified, that is, being valued for what they do, being turned into an object rather than a relational being. Oftentimes experience subtle abuse, and oftentimes experience excessive praise or criticism. And that's the amazing thing about this, is that oftentimes the thing that we think we are doing to help them give self-esteem doesn't work, because there's a subtle difference between acknowledging somebody's hard work and effort and equating or accidentally equating love and affection and attention with accomplishments. It has an intense amount of shame. Like all of these personality disorders, that's a lot of the root of it. And although these personality disorders that we'll talk about tonight manifest themselves in different stylistically, they have many of the same injuries at their core. They just are organized differently based on the person's temperament and their choices and the reinforcement they get from them. The blending of worth and performance, right? I'm worth what I think a lot of us can associate with that idea, right? I think in midlife, for me, that's part of what I'm coming to terms with, is that I'm not, what am I worth when I make a mistake? What am I worth when I don't get it right? Am I enough? Is what I feel enough? Because there's an equation of praise as affection. So it's important as parents, we get very conscious about our praise. I want to talk about a few different patterns in behavior. The surrender pattern: chooses critical partners and significant others, puts him or herself down, right? This is the surrender pattern of narcissistic relational. Chooses critical partners and significant others, puts him or herself down, right? It can look like that. Avoids sharing shameful thoughts and feelings with partners and significant others due to fear of rejection. Again, everybody on this webinar, I imagine, can relate to that. So you can relate a little bit to the narcissist, right? Theirs has become more cemented, more fixated, but you can identify with the pattern at least a little bit. And of course, overcompensation. Behaves in a critical or superior way toward others. Tries to come across as perfect. Note that an individual with this schema might not employ all three maladaptive coping responses. So there are different styles within this range. Lastly, of the three, cluster B personality disorders is antisocial. And that's a funny name. It used to be called sociopathic. And there's some argument that sociopathic, that sociopathology and antisocial are different. But essentially that was the old version of this. So this is somebody that lacks essentially empathy for others, is able to harm others without any sense of remorse or inclination to be sensitive toward, kind to, loving toward others. A pervasive pattern of disregard and violation for the rights of others. Begins in childhood as conduct disorder. Again, we want to be careful with this because part of adolescence, part of childhood is experimenting with rules and limits. But there's something a little bit more personal about this, right? And while some children might be cruel to an animal one time in their life, doesn't mean they have antisocial personality disorder. So we want to be careful before we go down the road of categorizing somebody with this. A pattern in adolescence of lying, stealing, rules, and social violations. It's marked mostly by a lack of remorse or empathy toward others. They also, too, can be charming. The famous one that I think is referred to in society is John Chapman, right? Rapists that become famous, murderers that become famous, they have an ability to charm others. And it's a complete facade, right? It's a calculated kind of charm. They have instability in their job and academic careers, right? Getting in trouble, getting fired, just constant problems with authority. They don't have realistic long-term goals, right? They have this inflated idea about what they can accomplish. Aren't willing to do the work to get there. Would rather cheat or take a shortcut or steal to get there. They want the get-rich-quick scheme and are willing by any means necessary to get there. Inability, of course, to make and keep a lot of friends. A lot of times when I'm interviewing people, I ask them, how many friends do you have? How long have you had them? The friend that you're closest to now, 2 or 3 friends you're closest to now, how long have they been your friends? They can be, of course, very impulsive, right? Make decisions, go from 0 to 60 in an instant with a decision. Become very full of rage, that communicate a lot of anger, a great temper, very irritable and impatient. And of course, they're going to have legal problems. To have this diagnosis, we're going to see these patterns begin in adolescence and then solidify in adulthood. Excuse me, this should say antisocial discussion. There's substance abuse often associated with it, right? The pleasure seeking, illegal activities. It has an overlap with narcissism. Antisocial does, right? There are parallels to it. The narcissist isn't fundamentally is incapable of empathy to the extent that he or she goes after and hurts other people, and maybe even derives pleasure from it. They don't see the other person. In narcissism, they're invisible. They disregard them. They dismiss them. They walk past or over them. So one is much more personal. One is much more dismissive of. Sometimes Asperger's, autism spectrum disorder, there can be a parallel or overlap because there's a lack of empathy, and that can be misread. Right? Then an Asperger's or autism spectrum disorder individual doesn't have a pervasive pattern of rule breaking and violation of rights of others in the same way, although they may accidentally be uncaring of other people. So there's some mixed diagnosis there. Someone who suffers from antisocial personality disorder actually, during times of crisis or violence or threat, actually become more calm. And I think we can see that in movies sometimes, the way that they're depicted, right? During a moment of high intensity or high stress or high threat, they actually have their blood pressure lowers and they become calmer. Whereas for most of us, we're upregulated during those times. It's important that we don't make simple equations in terms of what causes it. I think that's true with all of these. I think one of the sensitivities or difficulties with all of these cluster Bs is that we try to come up with one simple answer to it, and it's a multitude of environmental and physiological factors that contribute to it. That some people who get abused become compassionate, caring people. Some people that get abused and become objectified learn to objectify others. So it's not necessarily a simple cause and effect. And that's why we believe in therapy so much. We believe that these disorders can be treatable. They're difficult. They're somewhat cemented. But we believe that we can make progress with them. We believe we can access the strength, the wisdom inside of the person that has been buried. It takes a lot of work. The countertransference, the inclination to react to these individuals in ways that are not helpful and prove their point, that they're not cared about, right? That they don't matter, that they're bad people. That's why, as family members, you need help, outside help, because it's hard to put the fire out from the inside, if you will. You need somebody from outside with other resources. And it takes a lot of resources. These individuals require a great deal of capacity. And again, don't be fooled by how charming they can be often. They can be very, very charming. The fourth of the personality disorders in the cluster B is histrionic. Patterns of excessive emotional displays and attention seeking, right? Somebody said to me, kind of like Lucille Ball, and I love Lucy, right? Very exaggerated, very loud, very expressive, very extreme in their behaviors. Extraordinarily attention-seeking, looking for approval. Oftentimes with histrionics, with histrionic personality disorder, in my group with those tendencies, I would give them a lot of time alone, a lot of time one-on-one, a lot of time away from the group, so as not to reinforce that, because they're going to get reinforced one way or the other. Meaning that people are going to they're going to laugh with them, or they're going to laugh at them, or be cruel to them. In any way, they're giving attention. So a lot of times, learning to not react was an important part for the group, and putting the person in a place where they weren't getting that kind of reinforcement. They can be inappropriately sexual and seductive, right? That's a pattern that's common in histrionics. Also very self-centered, very unaware of others around them, of their effect on others, their impact or even the impression they're making on others. Very self-indulgent, extraordinarily self-indulgent. They can be easily offended, very dramatic in their, very, very overblown. Histrionics, we're familiar with that. It's that overreactive, overdramatic response to things. The persistently manipulative behavior. They're constantly trying to get people to feel, think, and do certain things, right? Using all kinds of emotional displays to try to get people. They can be easily influenced also at the same time, right? Because they're so sensitive, because they're so powerfully reactive, others can oftentimes manipulate them. And their ability, the emotional ability, their switching from one emotion, one feeling on a dime, and seemingly shallow feelings, like making big deals out of small tokens of affection. Like he wants to marry me because he asked me on a second date, to give a simple, silly example, would be an example of that kind of responsiveness. They can be exhibitionistic, which I've already described. What is the induction? The induction is to oftentimes try to be cruel to them, to tease them, to be mean, to make fun of, to gang up on them. That would often happen in the group. And so, again, trying to get people not to react, encourage people not to react. They often have somatizations. And let me explain what a somatic disorder is. A somatic disorder is a physical complaint and or illness that has as its root emotional distress. And I think the thing that people misunderstand is that somatic disorders can kill you. Like you can develop heart disease or an ulcer or all kinds of stress in your back and all kinds of real problems. But at the root of them is an emotional distress. It's a way of expressing one's need. Histrionic people are often complaining about many ailments. You're not allowed to be more sick than them. If you're sick, they're sicker. And just to make sure that they're getting the attention they need, they're going to oftentimes find ways to be sick, to feel sick, to complain of their illnesses. Again, passive aggressive, very low frustration tolerance and poor delay of gratification. It looks very immature, right? Maybe of all of these disorders, it's the most classically immature. It looks the most like a child, throwing tantrums, getting attention. It's interesting because there is a gender bias in the sense that some of the more basic parts of histrionic are also considered feminine, right? More emotional, more sensitive, right? Greater displays of emotion, whereas the masculine trait or male trait oftentimes is more reserved. And so there could be we could look at two individuals and not take into consideration the fact that there are differences in socialization with men and women and masculine and feminine in our culture. Oftentimes they'll suffer from great anxieties or depression. So they say it's comorbid with those. And sometimes they can be treated with medication. It's very important to treat the entire system, though, to look out for those reinforcers. So what are the take-homes? For the individuals, it is to be vigilant. It is for all of us to be aware of the patterns. All of us could fit and find some characteristics that we could identify with. So to be aware of our pitfalls, of our weaknesses, of our individual Achilles heels. The themes will continue throughout your life, even when you are not at the clinical level, for all of us, right? If you're codependent, that's going to be a theme of your life. You might not be at a clinical level after a few years of treatment, but it's something to be watchful of. To learn the inductions, right? To learn how we get pulled into these and to find ways not to respond. And with all of them, and most specifically with borderline, remember that you cannot win. You can only choose how to lose. Learning assertive training and communication. A lot of times I encourage people to take individuals at face value a lot of the time. And so if somebody comes in with this histrionic sighing, you don't necessarily respond to it, reinforce the passive-aggressive behavior. You assume that they just needed to sigh because maybe they were tired. So you require people to use their words. And then you train people in communication and assertive training so that they learn to use their words. Learn your own boundaries. I mean, obviously there's so much around these that pull us into their boundaries, that make us a part of the drama, that cause or trigger our guilt, that cause or trigger our anger, and that we tend to react in less flexible and less conscious ways. So learning what's going on inside of you, that's intrapsychic boundaries, and then learning your boundaries in terms of what you will or won't participate in. Those are your interpersonal boundaries. Punctuation is an idea in psychology and family systems theory that says it's really circles. Our relationship dynamics are circles. You can punctuate. You can cut a hole in that circle and stretch it out to a line and punctuate. In other words, you can say that I started talking about how great I was at a sport, and so you felt the need to kind of point out that I was being arrogant or cocky, and then I didn't feel hurt or seen, so I start to talk about it. So you can punctuate it anywhere. Anywhere can be a beginning, right? It's really a chicken and the egg discussion. And so tracing it back to the quote-unquote beginning doesn't make sense because it's really a circle, and punctuation is arbitrary. The work that we have to do is our own work on our family of origin, on our codependency. We have to take back our own hope, take back what we can't control, learn to process the guilt and shame that we have, and to be accountable for our stuff without that overlay of shame that I always talk about. Can we as parents look at the fact that, yeah, we left a dent on our children. We left our stink on our children. And we don't have to hit ourselves over the head or beat ourselves up for it or give up or punish ourselves or run and hide. We just know that that's part of being human. So we figure out ways to turn that realization into a piece of work that we can do. And of course, tracing it back to all of our families of origin will be very, very helpful. All right, Stephanie, I'm happy to take any questions or comments. We have been told that my son has borderline traits by more than one professional. First, can the lack of attachment be mended? Also, when you said choose how you lose, can you explain that a bit more? There's definitely no winning. Thank you for doing this webinar. I've been waiting for it. By choosing how to lose, it's trying not to be right in a discussion. Trying not to prove that your point is right. Surrendering that altogether. I was sitting with a clinician one time where I told this story a couple of weeks ago, where he was working with a young man with with borderline personality traits, and he kept on trying to process that the client was angry with him and kept telling him how angry he was and how he had abandoned him and let him down and took a vacation week and then didn't care and then walked away before they were done talking and then cut all this stuff. And very patiently, the therapist was trying to process and listen and reflect and kind of point out inconsistencies. And I said to the young man, I said, is there any way that he can prove to you that he loves you? And he said, no. And I said, okay then. There we have it. You stop trying to be right. Stop trying to prove your point. Stop trying to make them understand, make them get it, make them see the light. You just understand them. Understand from them. It's a hopeless, unwinnable situation for them. So they want you to feel that same thing. That's what choosing how to lose means. Stop trying to be right or get them to see the light. Just understand for them, it is an absolute damned if you do, damned if you don't life that they're living. So, it can be very challenging. Can you give examples of DBT techniques? One of them is mindfulness. I did a DBT webinar. I'm going to do another one in a couple of weeks. Mindfulness is one of there's 4 separate categories and they're various skills. Let me wait to answer that question until I refresh. It's not a model that I use there's emotional distress tolerance, there's skill building, there's mindfulness, and there's something else. I didn't brush up on it today, but you can look it up on Wikipedia, dialectical behavioral therapy, and you can see the 4 categories that they do training in. We do a lot of course, mindfulness here. A lot of meditation and mindfulness. Is it true that people with personality disorders do not see themselves as needing help? How can we encourage someone we love, adult child, to get help? Yeah, it is true that when you're, it's like that saying, you don't know what you don't know. They just don't know it. They can't see it. They see the entire world as broken. See, to make sense out of the world, everybody else has to have the problem. Everything else is broken outside of them. So it's an incredible threat. So how can you do it is just to be the most loving, kind, non-judgmental, compassionate, caring. Don't force. Don't fight the defense. Don't try to knock it down and tear it down, but rather try to get understanding and compassion. Ultimately, setting up boundaries that save you are important and essential in this, right? You can't go beyond what you can tolerate and what you can be okay with. And that's another way of choosing how to lose. You will be accused of by these individuals of not loving, not caring, giving up, abandoning them, so forth. I mean, just go down the list and choose the one that you don't want the most, and that's the one you're going to be accused of. And in that way, you have to be willing to lose. It's the same with dealing with somebody with a substance abuse problem. You have to be willing to be what they accuse you of when you set a boundary. You have to be willing to lose in the way that you want. Can broken attachment be mended? I missed that. Yes, over time it can be mended. And, Moreno, the creator of psychodrama, said that we are wounded in relationships and therefore we heal in relationships. I know I've shared with you all many times that I've been with my current therapist for the past 17 years. And in that relationship, a lot of my attachment issues have been healed because I have an experience with somebody else that was different than the one that I grew up in, different than the context that I was raised in. And to be accepted and loved and seen and understood and resonated with, even in my craziness and my stupidity and my mistakes and my flaws and my diagnoses and all of that, it has done a lot of healing. And I plan to continue to work on that healing for the rest of my life, to continue to heal the attachment issues. I mean, so it can be, but it takes time. And it takes years, and it takes having a different experience. And oftentimes it can't be done very easily or well by the parent themselves. It can, but that requires a lot of work on your part. And that requires you all healing your attachment issues. Right? Attachment is a big deal for everybody. And attachment issues affect us all. Our attachment issues are the things that prevent us from connecting to our children, from seeing them. Our attachment issues are our trauma. And our trauma prevents us from responding in a patient, curious, compassionate, insightful way to our children. So yes, it can be mended, and it takes years. And therapy will change for you over years. Therapy becomes something different much later on than we think it is. It's not problem solving. I mean, that happens in therapy. It's not training or teaching. That happens in therapy too. It's experiencing something different. It's experiencing oneself as okay. And that can only happen in relationships. And that's why residential treatment programs, wilderness therapy programs can be so helpful, because the immersion into it is so powerful and such an accelerator when you're talking about healing attachment, right? Because 1 hour a week, 2 hours a week, maybe 3 hours a week if you're going to analysis, classical analysis, that takes years and years to add up, to compete with. You want to create competing memories, competing experiences. My therapist, who's a fantastic author, fantastic therapist, J.D. Gill, you could take a look at some of her books. Finding Human is one. She has a new one coming out in January called Seeing, Seeing. It's a fantastic one that discusses this. And it's from Finding Human, where she talks about creating competing memories, competing experiences. And the research in attachment, and there is a mountain of it, talks about creating competing experiences that compete with the attachment wounds of our early life. All right, folks. Thanks for joining us. Thanks for your questions. Just to run over some of the upcoming slides, Finding You in January, Finding You in February. Those are our intensives. 6 people. I do those. Very deep work, family of origin. If you want to go deeper with your work, those are the ones that you go to. We don't have any workshops on the horizon, though. We're just about to schedule some. We'll let you know. You can see the numbers and the emails there for more information. We want you to go to 6 12-step groups, 6 12-step support groups. while your child is with us. If you haven't gone yet, please go. Just try them out. Al-Anon.org, CODA.org, FamiliesAnonymous.org, Naranon.org, Al-Anon, Alateen.org for young people. And then, of course, you can go to NAMI.org to get resources, classes in your area at affordable or free. We don't have any more parent support groups for the rest of the month of December. The first one on the schedule is in January. I will be at that one. It's been a while since I've been out there, so I'm happy to go back. January the 4th at 6:30 to 8:30 at CUNY. There's the address there. Email Stephanie@evoketherapy.com for more questions or more information. Follow us on podcasts for iOS devices or SoundCloud, the SoundCloud app for Android devices. Evoke Therapy Programs is the search for our podcast. Follow us on Twitter and Instagram, Facebook. Search Evoke Therapy Programs. Find the Second Nature Alumni Foundation on Facebook. And then, of course, go to our blog. Pursuits are our Therapy Light High Adventure Trips. My book, The Journey of the Heroic Parent, is available on Amazon, or you can go to the Parent Alumni Foundation book page and buy my book or other books that are recommended by our therapists. And those part of the proceeds go to families who can't afford treatment. Looks like a couple more questions have come in, so I'm happy to take a couple more questions, Stephanie. So if I hear you correctly, we can't choose how to lose. We can only accept that we are going to lose. Did I miss something? When I say you can choose how to lose, let's say that I finally decide to set a boundary with my alcoholic wife or my alcoholic son, and I say, I'm moving out, or I can't live with you anymore, you can't live with me. I'm choosing how to lose, because they're going to hate me, blame me, call me selfish, say that I don't love them, say, see, I knew you were going to be. I get to choose how to lose. That's what I mean by that. I'm choosing to be the bad guy, but I'm choosing to take care of myself. That's what I mean by you do get to choose how to lose. In my personal experience, doing a Finding You intensive will help heal your own attachment issues. Thank you so much. I think that's really what we try to get to at the Finding You, so thank you for that comment. All right, folks, thanks for joining us. Thanks for and on behalf of your children for joining these, for doing your work, for being interested. This is the heroic work, and I thank you for on behalf of them, and just want to acknowledge you being here. I'm going to take next week off. I'm on vacation, and then I'll be back on the 27th for a webinar. I'll be talking about parenting styles, authoritative, and permissive styles from the literature. Have a great week. And for those of you who celebrate Hanukkah and Christmas, have a happy holiday, and I'll talk to you in late December. Take care. Bye-bye.